The stories from endometriosis patients are so daunting. Years waiting for proper diagnosis, care, and surgery. Some get so desperate that they spend tens of thousands of dollars for care, traveling outside of Canada.
My surgeon described it as severe stage 4 inflammatory endometriosis. My my organs were fused together in the end. So my uterus, my bowels, my bladder, my appendix, everything was just formed one big ball.
Amanda Frucci had surgery just 3 weeks ago in the U.S. While in Canada, she's been on a wait list since February.
Every time I got a call from my GP saying we got another rejection, that was like the most frustrating.
The wait time is at least 18 months, a reality for many with endometriosis, a condition where the lining of the uterus grows elsewhere. Some experience chronic pain. It was so debilitating for Amanda. Fed up, she got a $25,000 line of credit to pay for surgery in the U.S.
I want someone to tell me why I was not able to get this surgery done in Canada.
Surgery helps with pain, and it can be life-changing. Dr. Andrea Vidali, an expert based in New Jersey, says he typically treats 4 to 5 Canadians a month.
There's probably a significant number of people coming from Canada for sure. There aren't enough specialists. And this is not just Canada. This is the United States. This is the UK. This is everywhere.
Other factors put patients all around the world in difficult situations. Canada's healthcare system is celebrated internationally, including by Dr. Vidali. But he says there are some gaps.
You have this tiered system where people have to first see the generalist before they move up to the next level. So what happens is that there's a delay in care due to that too.
Eileen Holoka calls the wait times extreme.
I looked into going into other provinces to try and get care, but the doctors who are good in those provinces are so backed up. I believe so strongly in public health care, and so I felt like I was a traitor for leaving the country.
The Center for Endometriosis Care in Atlanta operates on 100 Canadians annually. Eileen was one of those patients last year and says her quality of life has improved.
The only reason I was able to access it, and it's sort of a privilege, but it's also a sad thing, is because my brother passed away and left behind some money.
It was a rough winter and fall and spring.
For Amanda, taking on this debt for surgery was worth it.
Oh yeah, mommy for the win!
And for her 2 kids, who finally get to enjoy an afternoon game of soccer with mom.
I'm so looking forward to the life that they want to have with me and that I want to have with them. I'm looking forward to having my energy back.
We don't know exactly how many Canadians are traveling outside of the country for endometriosis care. Health Canada says that information isn't known and the data isn't collected. In Toronto, I'm Faiza Amin for City News.